Megan, welcome.
Thank you so much. Thank you for having me.
I'm really excited to have you here. Today's episode falls under the health and beauty category. And if there's one thing that keeps me up at night, as I've shared with you, being a mom of a teenage daughter, is this conversation that we're about to have around the unrealistic beauty standards that have been normalized in 2025. When we grew up, getting a facial was the extent of what we would do to our faces. But today, in 2025, getting plastic surgery, getting injections, making tweaks seems to be normal. We talk about it, it's out there. And there are things that we need to consider from a health perspective. And you have, a pretty powerful story in terms of what happened to you. And now you're leveraging your platform to bring awareness to this topic. So I would love to spend some time, first of all, starting with your story.
Okay, right. And as people are going to hear, everyone wants to look their best, right? And I certainly fell prey to that and I did fall prey to the marketing. I tried Botox and was injured by it, which I will tell you the whole story in a minute. But I just want to start by saying I don't think that there's anything wrong with wanting to look your best. I really don't. And I'm grateful for technology like microneedling and a lot of this stuff that's come out in recent years, red light therapy, a lot of these technologies can be really great and healthy for our skin. But my message is that neurotoxins like Botox, Dysport, and Xeomin are just never worth the risk because these substances are so incredibly lethal and toxic. In fact, they are the most toxic poison on the planet. And if it goes wrong, your life can be destroyed. Life as you know it will be destroyed. And so I'll jump into how that unfolded for me. I am your average 36-year-old American suburban mom. There's nothing special about me. My sister was doing Botox for a few years. I had a couple friends who had done it. Many of my friends didn't, but I did have a few, and they all seemed to be healthy and fine. I was getting microneedling done by a licensed and experienced doctor. She provided aesthetic procedures on the side at her practice, and she did Botox all the time. She injected it all day long. She injected it in herself as if it was no big deal. And so I'd been seeing her for about 2 years, and finally I sat down one day and said, "Okay, I think I wanna try a little bit of Botox. I just wanna try it right here in my crow's because I smile a lot, I've got some pretty good lines growing here." Um, and I didn't care so much about my forehead, honestly. My forehead doesn't bother me. I kinda like I prefer to look natural than, completely
Yeah.
smooth. That doesn't seem realistic at my age. So I just wanna try the smallest amount, and she gave me 12 units total of a brand called Xeomin. It's the same toxin as Botox, it's just a slightly different, like, protein structure. All these different brands, they create their own proteins so they can patent them. So immediately after she injected me on this side, on the right side, I started to have neurological symptoms. I didn't realize what was happening, but like I started to look around the room and everything was kind of spinning. I couldn't focus on anything. The injection itself hurt more than when she injected me on the left side, which actually later on I realized I think she hit a blood vessel.
Mm.
And that's why it hurt, but I started having brain fog and a lot of head pressure. And I was sitting there in the chair thinking, this is my first time, so I don't know what to expect. And I told her, I feel really weird. Like my brain just feels weird. And you could kind of tell she hadn't heard that before. Like I could tell she kind of like stopped and was like, "Oh, are you scared of needles?" Like as if I was having a vasovagal response, an extreme like kind of reaction to needles. And I said, "No, not at all." So she just kind of discarded the needle. Like we kind of sat there to make sure I wasn't having an allergic reaction, and I wasn't. And I left the office and I just started feeling really weird. Like I couldn't quite I had never felt like that before, honestly. The closest it came to was like when I was coming down with COVID and I had a lot of brain fog and fatigue and just weird head pressure. I tried to go to work that day. I only made it to one patient. I'm actually a speech language pathologist. So that'll come into play later when I started to not be able to swallow properly. I'm actually the profession that works with people who can't swallow or speak properly.
Mhm.
So I go home after one patient. I'm feeling so odd. I start to feel really dizzy and nauseous at home. I'm feeling really ill. And my mom was there watching my 10-month-old at the time. And I asked her if she could stay because I couldn't really take care of the baby. So, within the next few days and over the next few weeks, I started developing more and more symptoms that would kind of come and go. So, I'd have these really scary symptoms like head pressure or feeling like I just couldn't concentrate on anything, really out of it. But then it would go away. So, I would think, like, okay, well, let's just try to forget that happened. And then I also started developing essentially what we call fight or flight symptoms in the Botox injury community. It's not quite anxiety, but it's like a bodily anxiety, like almost like a panic, and you can't stop it. So normally, I had had anxiety before mentally, probably. You think
Mhm.
about like, oh, I don't want the kids to get sick, or are they too feverish, things like that. I had never felt heart palpitations, panic in my body, unless like something really scary was happening, like, someone cuts you off on the freeway, right? You get that little jolt. I
Mhm.
started feeling what it feels like to be cut off on the freeway all day long, every day for weeks. I would have to pace. It was like I was a caged animal, in complete fight or flight. And I stopped being able to sleep. I was having severe insomnia. And then what happened to kind of my really severe symptoms didn't start until about 5 weeks out from injections when I stopped being able to swallow properly.
So scary. Oh my
I
gosh.
know. And one of the reasons, so there's a lot that goes into the swallow, right? And as a speech pathologist, I knew this. And it wasn't that food was going down the wrong pipe for me. That didn't happen. It didn't go into my lungs, thankfully. What happened for me was I stopped making enough saliva to the point that my mouth was so dry that when I would eat solid food, it would just all kind of get stuck right at the top of my
Mhm.
esophagus. And it
Wow.
would and I'd have to, drink water, like 2 full glasses of water to get a bite of food down. So I just, for the most part, I stopped being able to eat solid food and I just had to focus on liquids. At the same time, I'm going through severe panic, severe insomnia that I had never experienced before. I had fatigue to the point where I could barely get up off my couch, could not work at all. I had to take 2 months of work off. And this whole time I'm thinking like, what is happening to my life? Like what is happening?
What's going through your mind? Like, what did I catch? Like,
I
what
I
are doctors telling you as you're going to see a doctor?
Exactly. Exactly. So I, of course, went straight to the ER. I work for this hospital system, right? So I actually have really good health insurance. And thankfully, my ER visits were not too costly. I'm not kidding when I say I went to the ER 7 times within 2 months because I was so terrified when I would have moments where all of my swallowing muscles would kind of freeze up. I told the doctors everything. I said, all of this started after Botox. Severe brain fog. I can barely think straight. I'm fatigued all day long. I can't sleep at all. Like that combination of fatigue, but not being able to sleep is horrendous. Every single doctor told me, no, 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 Botox cannot do any of that.
Really?
This is anxiety. Here's Ativan, which is a benzodiazepine, a very strong anti-anxiety medication, and sent me home. Now, of course, there were a few nurses along the way who kind of looked at me once the doctor left and said, "You're right." Like, don't do Botox again. Like, there was a nurse who knew what was up. She was like, because I think she recognized, she may have known someone else with Botox poisoning, but the fact is, when someone comes to you and says, my life was normal, I got this drug that's a
Yeah,
neurotoxin, and I
yeah.
have not been the same since, Like, you need to listen to that as a medical professional. And I'm telling you, I was gaslit even by so all the ER doctors, I was even gaslit by a fellow speech pathologist when I went to do my swallow test on the X-ray. We could clearly see that the food was taking like over 30 seconds to make it down to my stomach, whereas in a normal person that would only take 4 to 8 seconds. And the reason for that is because I literally was making hardly any saliva. So I didn't have that lube, you know? That's like
Yes.
your lubricant. And we're both just staring at the video and she goes, "You know, you've probably always had this and it's just probably anxiety." And I said, "No, I literally have never had this. And that's why I'm here on a Tuesday getting an X-ray when I should be at work, you know, or caring for my children. Like,
Yeah.
why would I make any of this up?" And, you know, I talk about this a lot, the gaslighting, because it is the same story over and over again. So you know, eventually figured out what was wrong with me after I went online and did more research. And I found this group of tens of thousands of people that this has happened to, and story after story. It was like I was reading my own nightmare all over again.
Which group is this? Facebook group?
Yeah, yeah, yeah. There's big groups on Facebook people can look into. Botox Dysport side effect support is one of them.
Mhm.
Uh, botched Botox is another one. I mean, there's some funny names, but these groups, you and I encourage everyone to join these groups. If you're considering Botox, if you do
I love
Botox,
that advice. That's
yes,
very advice. Before you consider, like, why don't you read some of these stories?
exactly, because some of these women and men, by the way, were just like you, were just like us, and they had been doing Botox for years and never had a single side effect, and then bam, one day
Yeah.
their entire world changed. And I really want to nail home the point that I was out of my normal life for about 6 to 12 months, could not function normally for 6 to 12
Yeah.
months. I had the most mild case out of these stories. Like
Interesting.
you start reading these support groups and you will see that people have been suffering for years with symptoms. A lot of people get secondary medical conditions. So I don't know if you're familiar with something called MCAS.
Mm-mm.
It's like an immune response when the body's been fighting something. So actually, women who have breast implants can get MCAS because their body is
Oh,
trying to fight off this foreign body, right? You can also get it from filler, but you
okay.
can definitely get it from Botox poisoning. And it's essentially the body starts reacting to histamines.
Yeah.
And I never had this, but I've spoken to many people who do, and it's so tragic because they really stop being able to eat a lot of the foods they would normally eat. Their diets become very limited, which can lead to nutrient deficiencies, right?
Yeah.
They start reacting to medications. Basically, their body starts getting like what you would think of as an allergic reaction. So, like hives or difficulty breathing, kind of wheezing with
Yeah.
just everyday chemicals, fragrances, you know, different high histamine foods. And I was lucky to have avoided that. And the only thing I can think is that it was probably because I had such a small amount
Yeah.
spread.
Yeah, small amount, and I'm sure it's also a combination of, the health and the state of your body. If you're not under a lot
Right.
of stress and things are functioning properly, right? Because that goes up and down depending on the month. So, what kind of interventions did you have to put in place in order to recover? Was it sort of detoxing, and who helped you with that?
I know, right? Everyone, you know, it's so funny. We are so conditioned in our society to like, oh, okay, if you get an injury or if you get something wrong with you, there's going to be an answer, right? And here's the thing people must understand about Botox poisoning.
There's no
There is
answer.
no magic bullet. The only true treatment, the one they give out at the hospital is called antitoxin. And here's the thing, they do not give it out. The CDC refuses to release it unless you are on death's doorstep with respiratory failure. And the truth is that Botox, I mean, if you just go to drugs.com, you can see a list of over 50 different symptoms that Botox can cause according to its own clinical trials, right? Like
Um,
drugs.com gets information from a drugs product insert. So you'll see over 50 different symptoms of nervous system disruption that can occur if this toxin spreads throughout your limbs. You can become paralyzed, etc. So the CDC and doctors really are only trained to recognize botulism in its most severe states when people are nearly paralyzed, or when their diaphragm is nearly paralyzed and their breathing gets weak. And that is typically the only time they'll give out antitoxin. And that needs to be done within 3 to 4 weeks after exposure to the toxin. So, what you'll see is a lot of people who get botulism from food, like poorly canned foods. This doesn't happen a lot in America. It happens sometimes in, other countries. You'll see outbreaks of botulism.
Yeah.
Those people get it so severe because they're eating large amounts of the toxin that they do typically end up getting the treatment, which is
Okay.
antitoxin. But what you will find in the Botox world, oh my gosh, it's just horrific. I mean, women and men showing up to the ER with difficulty breathing, difficulty swallowing, total muscle weakness, blurry vision. I mean, these are all hallmark botulism symptoms, and they are told they have anxiety and sent home. And they are told that Botox can't do this. And I will say, because I've done so much research on this topic, I've written 3 books now about all this. And one of them is a book for, doctors explaining what
I
iatrogenic
saw that,
botulism.
Megan. Amazing. So tell us about the 3 books.
Yeah, well, so the first one was just a memoir of what
Yeah.
happened to me, because I was looking for a book about, because I knew people had been getting injured since the 90s. Like, once you look back at the clinical trials, the FDA database, I mean, this drug has been harming people for over 30 years, and the manufacturers are getting away with it because they can just say, oh, no test for botulism. Sorry, it's probably not the Botox. Yeah. So I was looking for a book, like, has someone written about this? I couldn't find anything. So I was like, well, I'm just going to write the story of what happened to me. So that's a really short book. That's my first one, Me Talks Pretty. I named it it's like a play on words from the David Sedaris novel, which is called Me Talk Pretty One Day. So Me Talks Pretty is my first book, very short. The second book is called No Talks, and that takes readers through the history of the drug. A brief history of Botox, how it has been harming people, and people have actually sued Botox successfully. So a
Wow.
lot of people who, well, not a lot, I shouldn't say a lot, it's about 11 or 12 people have settled with the manufacturers because they got such severe botulism. And thankfully, the jury believed them and they won in court. These people are really, really strong for what they've been through, because it takes a lot to go to court with a big pharmaceutical company. I mean, talk about the most powerful companies in our country, in the world, is many of them are pharmaceutical industry. So anyway, so Botox has been sued. They now have a complete black box warning on their product. This product can kill you. It will warn you of that. But so many of us are not given that information.
Right, which was gonna be my question. Do they give you anything before the injections? Do they
Well,
talk
they
side
are
of do they get you to sign something that you don't even have time to
That you
read it
don't
out?
read, exactly. A lot of us don't read it. They are supposed to be saying that, yes, the toxin can spread, it can cause difficulty swallowing, breathing, and
Mhm.
speaking. But, a lot of times it's either not on the consent form, or, yeah, it's in that little tiny font. You never read it, you just sign it at the doctor's office. I've never spoken to someone who actually had a verbal exchange with a provider who
Yeah,
said, hey, by the way, there are side effects. You need to know about these.
yeah.
Typically, the injectors, my own injector said, oh, no, not possible at all. Because I asked her, I said, I don't want to get difficulty swallowing from this. Because I read that on the ad they have in the doctor's offices. It said in small print, you can get difficulty swallowing. And I said, that's not going to happen from cosmetic Botox, right? And she's like, oh my gosh, no, never happens. Well, of course, that's not true. I bet she still tells that to patients she sees, even though she knows, because I went back in person with a whole laundry list of my symptoms and
Yes.
told her everything I'd been through. And she just looked at me like I was crazy. I mean, truly, like I was crazy.
Yeah.
So, sorry, I'll just finish up real quick on my books. I talk too much. That's why I'm a speech
Oh,
therapist.
please do, please do.
But I ended up meeting this woman in one of the support groups, and she had been studying the history of Botox. She had been in that group for like 10 years. She didn't have Botox poisoning herself, but one of her friends had. So her and she basically became like a mentor to me because I told her I love to
Mhm.
write. I want to write a book about this.
Yes.
So she helped me, kind of point me in the right direction for research. And so that's how I wrote No Tox, which is kind of the history of Botox. Again, very short book. People can read these in like 30, 45 minutes
Amazing.
because I want them to be digestible because I know a lot of people don't read anymore.
Yes, absolutely.
But,
Yes. Make it
you
easier for
know,
us. Why not?
yeah. So and then the third book I wrote is really geared towards medical professionals because of course, once this happened to me, I wanted to educate my entire field because we are the people that are going to be interacting with people who get these issues from Botox.
Yeah.
So I wrote a book called Iatrogenic Botulism 101. Iatrogenic just means caused by the doctor essentially.
Mhm.
Iatrogenic Botulism 101, and that takes medical professionals through like what are the signs and symptoms? How can they help patients get treatment? What are the do's and don'ts if someone does get poisoned? Because there's certainly medications that can make things worse
Yeah.
for botulism. So we want to avoid those while also, just giving our body the time and space to heal. And
Yeah.
that's really what it was for me. It was time and eating really well, like just trying to I basically don't eat any sugar anymore or hardly at all. I don't drink any alcohol, no caffeine, no
Mhm.
nothing, nothing fun. Okay. But it's okay because what you really learn going through something like this is like, oh my gosh, we take our health for granted every single day. We
Right.
never know when it's gonna be taken from us, and just be so grateful if
Yeah.
you wake up in the morning and feel normal and feel
Yeah.
good.
Yeah. Absolutely. And then in addition to that, what I love about your story, so you have this realization and then you write the 3 books and you're out there, getting this message. You started a podcast where you're interviewing,
Yeah.
women that had been injured. Talk to me about a little bit about that. And let's start with the why, because you're going through all of this yourself. You're a mom, you're a wife, you have, a profession. Where do you find the time and what's your why behind this?
Well, this injury hit really close to home for me. I basically became like one of my patients. I was at home. All of my patients that I see in the home are homebound. I
Yeah.
was homebound for months. I couldn't swallow properly.
Yeah.
I had severe cognitive symptoms like brain fog, memory loss at that time. That lasted a
Mhm.
couple months. And so it was like a wake up call. I was like, "Oh my gosh, this is the kinds of patients I'm working with every day." And so I just remember like thinking everyone needs to know about this. Like, as soon as I'm feeling better, I am going to tell every single person I meet about this because I didn't want other people to go through this, especially to take this risk as a mom or to
Yeah.
take this risk as someone who has a career that they love. The fact that I couldn't work for months actually killed me. I wanted to go back to work. And, it's so one of the first podcast interviews I ever did actually was on a speech language pathologist podcast because I was really just speaking to my peers and saying, guys, we must be screening our patients for Botox use because it's written all over the Botox website. This drug can cause difficulty swallowing, difficulty breathing, difficulty speaking, all of these things that speech language pathologists deal with. And I realized because of how much I had been gaslit, I just knew that there were other people out there that were going through this and being told that it was caused by anxiety or
Yeah.
caused by something else. And I thought back on a lot of my patients who I couldn't figure out what was causing their issues.
That's so
Severe dry mouth, difficult, and I was like, wow, I never once asked these patients, of course not. If they were using Botox, why would I? Right.
yes.
That was the message I really wanted to get out. So at first my passion started as like, okay, I need to tell my profession about this. Obviously, I told all of my friends and family. I wrote the book so really so that my mom could like hand it out at her, at her girlfriends' houses. Because if you want the word to spread, tell a mom because she'll
Yeah.
tell all of her friends.
Yes. Yeah.
So I really that's how it all started, and then it kind of evolved as I went along. I was like, we need to get this message out to medical professionals, especially ER doctors, so that they could be recognizing these symptoms. Injectors need to know about this, right? Injectors need to be asking their patients at every single visit, have
Yeah.
you had any of these symptoms?
And
Um,
what's the perception like in the medical field? Like, are they open to having these conversations? Like,
Speech language pathologists definitely are
yes.
open because I have that credibility there with them, right? I'm a peer. I would say that, I really haven't spoken to many doctors. Doctors are intimidating. I did end up telling all of the ER doctors I saw. I just messaged them on our on our text message system. I was like, "Hey guys, by the way, I figured it out." And some of them were open to it. Some of them responded and said, "Oh my gosh, I've never heard of that. That's super important to know. Thank you so much." Other people were not receptive. And that's one of the hardest parts about bringing up new information is that you have to understand these ER doctors, they're dealing with a lot of the same stuff. So it's a lot of like, falls or acute injuries, right? But then
Yeah.
it's a lot of strokes and, brain bleeds and heart attacks. So that's kind of where their brain goes. And anything beyond that, like if you don't appear to be in immediate danger, which
Yeah.
we don't appear to be in because our vital signs are typically all normal in botulism. And that was even true, by the way, back in the foodborne days where people would have totally normal vital signs. So normal oxygen, normal pulse, blood pressure,
Yeah.
and then literally die within 12 hours.
Wow.
And that's how botulism works. It doesn't tend to um, make your vital signs all that different. And your blood work, it doesn't show up on any blood work. So,
Interesting.
the ER looks at us, ER doctors look at us and they're like, there's nothing wrong with you.
Yeah.
And we're sitting there freaking out, right? So, um, it's hard. It's actually really hard to convince ER doctors that this is a real thing. Because I do have a couple doctor friends and my mom's friends, kids are doctors, and she shared it with them. And the feedback was kind of like, oh yeah, this is probably because you used Xeomin and not the brand name Botox. And I said, no,
No. Go
no,
on the
trust.
Facebook page. Go on the Facebook page and
Oh
listen.
my gosh. It
Yeah.
is and that's the narrative in the media, and that's what they try to spin is that, "Oh, it's the counterfeit Botox. Oh,
Mm.
it's the unlicensed professionals."
There's counterfeit Botox. I didn't know
There's
that.
oh yeah, there's this whole world of it's Botox, it's the same toxin, but it's, typically at a much higher concentration, so
Mm.
people end up getting sick faster or easier than they normally would, because it's so potent. And that's an issue in a lot of other countries, not as much in the US unless people are buying it online, which, my gosh, this is what we should all be worried about. People are buying Botox online and
Yeah.
injecting themselves.
Oh
And it's
my.
it's not the brand name. It's like these Korean brands, these Chinese I mean, this is like the black market online. We had a gal come into the support group who had injected herself. And I said, this is not going to be the last
Well,
one we see of this because this is going around on these apps like TikTok that
yes.
all the young people are looking at. I mean, it's like girls in their 20s. I mean, these are girls to me. I'm like, you're not a woman.
Oh, the same way. When
I
I
know.
see this on social, I'm like, oh my gosh, you're so young. You're
I
still a
know.
girl your whole life. You're so beautiful. There's nothing wrong with you.
Yes.
This is what keeps me up at night. That's
I know.
exactly it.
And didn't you like when you were 22, weren't you like, I am the hottest thing around? Like that's how you weren't
Right.
worried about wrinkles. Like I feel
What?
like
There is no wrinkles to worry about, you know?
no,
Think,
no, you should be enjoying,
yeah.
yeah, enjoy your life. And that doesn't mean, again, that doesn't mean you don't, just pay attention. Things like, oh, I don't want to sunbathe all day long. That's probably not good for your skin.
Yeah.
But I really think this culture that's been created on social media is just, yeah, it's hyper focused on image. It's
Oh my
like,
god.
God forbid you have a few wrinkles by the time you're 40. Um, this is not what makes women beautiful, having perfectly
No.
smooth faces. This is not where beauty is born. It's not where beauty lives. I mean, beauty is so much more than our
Yeah.
skin. And, I'm a big believer in taking care of our skin, but not at the risk of what Botox brings to the table. I mean, this
Abs
this drug has destroyed lives, and I am
yes.
very serious about this. And, people sometimes I'm not the best spokesperson because I did end up recovering. And so I always nail home in my interviews, I am one of the lucky ones. I got very lucky and I recovered relatively quickly. I know so many women, most women who have taken years to recover and who are never fully the same.
Yeah.
Many people end up with permanent damage or like permanent lifestyle changes. They had to quit their job or they
Yes.
have to now.
Full-time job. There's one lady that I follow on social as well. I found her a few years back, and till this day, I wanna say it's been at least 4 years, 5 years, she's
Yeah,
still searching. Like, it's become her full-time job, and every time I see a new post, she's somewhere else testing some sort of a, solution, protocol, procedure. Like,
yeah,
it breaks my heart. Like,
yeah.
it's become her full-time job to recover and find answers.
I know. And another thing I really wanna nail home to women, my hair looks okay right now on camera, but I am not kidding when I say that I lost half of my hair throughout this
Wow.
process, and I have grown some of it back, but I had real thick, nice hair like you, and I mean, within 4 days after the injections, and mind you, I had 4 babies, so I knew what a normal amount of hair loss was. I really hadn't noticed hair loss
Yeah,
in postpartum. Within 4 days of Botox, I went like this in the shower, and I was like, "Oh my gosh." Like, there was so much hair. That continued straight for about 3 months, and I am talking about waking up in the morning to a pillowcase full of hair.
yeah,
Can you imagine how awful and scary? And then you start seeing, like, your scalp come out, and it's just like that was actually incredibly emotional
yeah,
and really hard for me, and, obviously, my situation could have been a lot worse, but, everyone's on their own journey, and hair loss is part of this poisoning for a lot of people, not for everyone,
yeah,
um, because, again, it depends on where the toxin lands in our body.
yeah,
And I happened to get a lot of hair loss, and that I really struggled with, self-esteem, wanting to leave the house, all of these things for months and months and months, and it's just and I still struggle with it, to be honest. I've had to
yeah,
just accept it and get
yeah.
used to it, but, I mean, can you imagine a 22-year-old losing half her hair because of some stupid Botox? Like,
Honestly, it's so scary.
I know,
Listening through your podcast, some of the stories, I mean, oh gosh, like there's just so much things that you would never think,
I know.
could possibly happen, could be a side effect. So you've obviously have spoken to a lot of women. Like how many in total would you say that you have spoken to? And out of all of them, which one is the story that really stands out for you?
Well, on the podcast itself, I've only done 12 interviews, but I
Yeah.
have spoken to many more individuals with this poisoning, and
Yeah.
I've probably read through honestly hundreds of stories, if not close to 1,000, because I would read through every single story
Yeah.
looking for people who healed when I was initially sick. But I mean, some of the ones, gosh, this one woman who haunts me, like her story haunts me. She had 24 units. It was like her 11th time getting Botox. So she had
Is that a
had,
lot? 24 is a lot. I think
it's
you said
not a lot. It's
mm,
not a lot. It's average, a little bit less than average. I would say
oh,
average is 30 to 40.
okay.
Um, so she had had Botox with 0 side effects for
Mhm.
years, and
Yeah.
she went in for 24 units, and she ended up developing something called ME, which is a condition where it's essentially, the body is in a state of hyperinflammation and you get really fatigued. And basically, she described it to me as like she can't even leave the house. She's homebound. You know, lights and sounds are too much for her brain if they're too bright or loud. She struggles with blurry vision still. She's 2.5 years out. She can't leave the house. She has no relationship really with her children anymore, who are still very young.
Mm,
She can't take care of them. I mean, her entire life was destroyed,
yeah,
and she had severe symptoms right away almost, and was turned down by hospital after hospital. She was a perfect candidate for antitoxin. I mean, she literally had every single botulism symptom you can think of.
yeah,
It's just horrific. They told her she had postpartum depression
yeah,
at the ER. I mean, it's just horrific gaslighting. Um, but many others have experienced similar issues. You know, people get really scary heart issues because the toxin can weaken your heart, and it can also affect your vascular system and your blood pressure. So
yeah,
people end up getting like tachycardia and arrhythmias. Its most severe form, botulism, used to kill people just by heart attacks. That's
yeah,
how people would die in foodborne botulism as well as Botox botulism. Um, and you'll read that on the package insert. It says, "By the way, this product can kill you and it can cause cardiac arrest."
yeah.
And people think they need copious amounts of Botox to do that, and they really don't. Um,
No,
there are people that we know, it's hard to say. You would have to really dig through the FDA database. It usually doesn't tell you how many units someone has gotten, but I know people who have been very close to death after cosmetic doses, just 30 or 40 units.
wow.
Having to be on a ventilator. Um, this one woman who reached out to me was on a ventilator in the ICU within a week of cosmetic Botox. Her injector did not believe her when she was saying, "I feel weak. My muscles feel weak. I don't know what's happening. I have blurry vision." Her
Yeah,
injector just said, "Oh, it sounds like you're sick." Like, "Yeah, I'm very sick. I've been poisoned." I'm
yeah,
very, very sick. And this was a case where I actually reached out to the injector because I was so appalled at her behavior, and I was so worried about this woman, of course. And I was polite to the injector, and I called her office. I said, "You have a patient that has botulism right now, and you need to
yeah,
get them treatment." And she said, "Well, I can't speak to you because of HIPAA laws." And I said, "Okay, fine, but you know who I'm talking about, and you need to get them treatment." And what ended up happening in this particular situation was, thank God this woman's primary care doctor believed her, and he got her antitoxin. And this was different than the injector, of course. The
yeah,
injector was off, posting social media reels while her patient was in the hospital. But this woman's, primary care doctor, bless his heart, he got her antitoxin, and that doesn't mean that she was instantly cured. She still has a long road to recovery
yeah,
because antitoxin can't reverse damage. It can
yeah,
only prevent new damage. So she was saved from a worst case, but she still is probably in for, potentially 1 to 2 years of recovery from botulism. Um, it's stories like these, you hear them and you get worked up at a certain point because
mhm,
you see the
absolutely.
injustice.
And so in terms of resources, so we have your podcast that people can listen to. You mentioned your books. Where else can people go to actually learn a little bit more? The Facebook page that you mentioned.
Yeah.
Where else can people go to learn a little bit more?
Well, I have a whole website called iatrogenicbotulism.com. And
Amazing.
that has a lot of resources on it, not only for consumers, right? Patients who use these products and potentially get poisoned, but also for medical professionals. Because I want people to be able to go to a website where they can just like print out a one pager, something they could bring into their doctor, and their doctor can see, oh, there's references to the medical literature. There's,
Amazing.
citations here. This is a real thing that's happening. And so I made that whole website and I update it every now and then. But my books are all on Amazon under my name, Megan McCue. And, there are plenty of other social media accounts talking about this too. One of the biggest ones is called Never Talks.
Mm,
Another big one, and these are all on Instagram.
yeah,
Botox and filler side effects is a really good one. Tons of data on there, tons of, just stories.
yeah.
And I honestly at this point think that the stories are more powerful than the data
Or I
because
tell you, this
yes,
podcast listen to, the episodes that you have, I was like, "Oh my
I
goodness."
know, because you can really imagine if it was you or your sister or your daughter.
Yes, and I
Yeah.
remember I can't remember which lady it was, but you could even hear in her voice that she's still so broken by all of this, right? Because you're obviously at a point in your journey where you know you've recovered and you have the confidence to
Right,
talk about it and tackle
right.
on bigger things and be able to share this word. But this lady, it felt like I really felt for her. I could hear in her voice that she's still struggling with it. She's broken inside because of everything that's happened to her, her confidence, all of it.
Yeah, and that's the case with so many people, and it's really this is why I am so outspoken
Yeah,
because if people only knew what they were risking with these little injections that are marketed as perfectly safe, perfect, no side effects or very minimal. Oh, that's so rare. Well, it
yeah,
turns out it's really not as rare. In fact,
yeah,
there was just a 2025 study that came out of London and they found these symptoms, these truly botulism symptoms. We're talking muscle weakness, nerve
yeah.
pain, blurry vision. These were all occurring at rates of 1 to 5%.
Wow.
Those aren't small percentages when you're talking about millions of people.
Yes.
And again, it's usually what's usually happening is that people are getting these symptoms, but they're being told it's not the Botox, so they're not reporting them. They
No.
don't ever report the symptoms to the FDA. So the
Yeah.
data we have from the FDA, you can really multiply it probably by 10 to 20 if you want the real numbers.
Yes.
And there were over 600 people that died after Botox last year. So you can multiply that probably by, 10 to 20 and come up with a number closer to about 10,000.
Wow.
And
Now, what about alternatives? So for people that do
Mhm.
want to, you know, do something, they feel like, listen, there's a little bit of tweaking I would love to do. Are there natural alternatives? Are there things that you've sort of found in your research and the work that you do?
well, I kind of got sucked into that world. It became my algorithm because I started talking against Botox, which is
Share
funny.
the knowledge. We want to know.
Well, and I always tell people, I'm like, I'm not an esthetician. The best person to consult with would be like a really good holistic esthetician that's also against Botox and uses
Yeah.
alternative methods. But I
Yeah.
will just tell you what I do, which is I do a lot of microneedling. I
Yeah.
wear hats. I try to keep my face and chest out of the sun as much as possible. I do red light therapy, and a lot of people love the frownies, like the little stickers, the face tape that kind of stretch
Yeah.
out your skin.
Yeah.
But I personally don't do that too often. I'm just at a point where I'm like, I look fine. I'm
You
like,
know what?
it's good enough.
You keep on saying that, and you know what? I was
Yeah.
actually the other day. I can't remember who it was, but it was one of the someone with a big following. It could have been one of the celebrities as well, one of the actors
Mhm.
that was saying, you know what? I love me. I don't want to look like someone else. This is me.
No,
I'm actually happy with me, with Magdalena, the way she looks. This is me. I don't want to be someone else. I'm not Karen. I'm not, Josie. I'm Magdalena. And this is what
I
I look
know.
like. And I love
And
that. And we need
you,
those examples because
I
too
know.
many examples are, just something completely different.
I know. And look at how beautiful you are and so
Yes,
naturally too.
I
You
know.
are. And
We get, yeah,
and that's the other thing is, it's like Botox, like smooth skin, it just I mean, to me now, honestly, it gives me PTSD because you can actually tell when someone does a lot of Botox. You can
yes,
tell. It doesn't look natural. It looks frozen and like
yeah.
how is your face that smooth? That it always looks a little weird to me with the eyebrows all arched. And another thing is the fillers are so scary to me. I don't think anyone looks good with those.
I know. I know. And I find that, because I read somewhere too that, people that really get into it and do a lot of it and
Mhm.
oftentimes there's things that also, happens in sort of in their brain in terms of how they view themselves and they go overboard a lot of
Right.
times. And you look at them and you're like, oh my gosh, what happened? Like, how did you
Right.
think that this is okay to look this way? Right.
Right.
But it's just like over time, I guess you just want more and bigger, and I don't know what the search is for. It's
Well,
just
they
so interesting.
become their brains become desensitized to it because they
Yes,
start seeing all these images that
yeah,
really do not look like real humans, and,
no,
with those those weird puffy cheekbones,
yeah,
it's sad, it's honestly sad, it's a dysmorphia. I do think it's a mental health thing
yeah,
because, um, and it's absolutely fueled by social media. There's no other I mean, celebrity culture has been a thing for a while, but like you were talking about earlier, how Botox, it's almost like it's a middle class thing now. Like everyone's getting Botox. And
everybody, yeah,
yeah, and that's just within the past, what, like 10 years? Not even. So, so yeah, it's really filtering down to just about everyone. And I just think that it's not headed anywhere good. But, I do have hope and faith because there are now quite a few people with very large
yes,
audiences, which is not
yes,
me, which is fine. I don't want a large audience. But there's many other women who have very large audiences who are speaking out about how Botox poisoned them. One of these women's, her name is Arielle Lorray, and she has a very
okay,
big podcast. She'll talk about how Botox poisoned her. Another woman's name is Jamie McGuire.
okay,
It's an esthetician actually who got poisoned by Botox, had been doing it totally without symptoms for 10 years. And then
wow,
again, boom, one
yeah,
day life change goes in for the routine appointment. And it's just like it's Russian roulette. How do
yeah,
you ever know when you're going to be the next victim? You don't. And people are so surprised when it happens to them because they were told it could never happen to them by their injector, and it's just this culture of, there's so much money to be made in this procedure that, like, you've seen my Instagram, so you see how I kind of do a lot of satire with Botox injectors. But, there is some truth in that, like, who wouldn't want to be a Botox injector? Like, I don't have to work at the hospital and clean up people's poop anymore. Like, who wouldn't want that job? Like, you just sit there and inject people all day. And you're making so much more money than you could ever make as a nurse, as a pediatric nurse, for example.
yes, yeah,
So it really is this industry that's just kind of fueling itself. And I just, my work is trying to reach the consumer, I think,
yeah,
first and foremost, and asking them, telling them what the risks are, and then asking, are you really willing to take these risks as someone who, doesn't want to stop doing their life, doesn't want their life to be destroyed? And are there other procedures you can do like microneedling or like face taping that come with far less risks? And guess what? Are actually healthy for your body and healthy for your skin. Botox
yes,
over time
yeah.
is atrophying your muscles, which creates sagging skin over time. And then of course they need all the filler to plump themselves back up, right?
Yes, and the other thing that I heard is, for a long time, they talked about the fact that, um, it doesn't stay in your body. It's kind of,
Or
released.
stay in the muscle, right? It's
Yes,
always
but now I've heard that that's actually not the case. It's not. It just kind of stays in your body and just starts moving around. It's never actually released. You never detox it.
Well, it can stay active. I actually had to speak with a university professor to learn this. She studies the toxin in her lab and has been
Yeah.
studying it for 20 years. And I said, how is it that people are having these symptoms for so long? And
Yeah.
she said it can stay active at the neuromuscular junction, which is basically where the nerve meets up with the muscle, or in the case of your nervous system, imagine two nerve cells are meeting up with each other. It's kind of, there's that junction right there, called a synapse, and the toxin can stay active at that synapse for potentially years. So
Oh
if
my God.
you get like an over injection, or, it's like what happened in my case where I got hit in a blood vessel and it just traveled throughout my bloodstream and landed basically in my vagus nerve, and in my brain. But, especially the brain, like getting back into the brain, which it's been proven now multiple times, there's no question about it.
Yeah.
Botox itself has their spokesperson out there, Gene Carruthers, talking about how Botox, we know now that it can travel back into the brain and turn off certain neuronal activity in a certain part of the brain. And she's saying all of this on camera as if it's a good thing. And I just thought to myself, oh my gosh, is she trying to bury her grave? Like, or make her own grave? I mean, maybe she is so, out of it from all the Botox that she
Yes.
doesn't even realize what she's saying.
I was
Who wants
watching
this?
a show, an episode about people that go in to actually undo some of the procedures.
Mm,
So injections and everything. And there's also side effects for now trying to remove them from your face.
I
And they show,
know.
potential situations that could happen. I'm like, oh my goodness, this is never ending. This is
It's a
just never
mess.
ending.
Don't ever start. That's what I tell people, is just don't ever, ever start. Stick to the preventative stuff, stick to the stuff that's actually going to make you healthier. Gua sha is another one I just remembered, facial cupping, things like this.
Acupuncture is a good one too. Face acupuncture, I heard, is a good one too.
Yeah. Yeah.
Yeah.
And most of all, just look in the mirror and say, I'm so grateful I get to live another day
Yes.
and feel
Yeah.
good.
Feels
Because so many people, so many tens of thousands, if not hundreds of thousands of people do not get to look in the mirror and say that every day because they've been completely poisoned by this drug without
yeah.
adequate warning, without informed consent, and there is no cure. No
Yes.
cure.
No cure. I love that post that you did about your mom. It's just kind of bringing back to like the way our parents used to live. It was like, we talked about we grew up with facials, but even our parents, like it was even more basic than that. And they're so
Right.
beautiful. Our moms, just the way they are. They
Yeah.
just kind of own everything that and it's from within, like you talked about, right?
Yeah.
It's who they are as a person, what they bring into the conversation, how they engage with us. And,
How they make you feel. How they make
yes,
you feel. It's like, did you ever look at your mom and think, "Gosh, you have too many wrinkles?" It's like, no, none of us
never,
do.
ever. I look
Not
at her
what
and
we're
I
thinking.
smile because, there's so many other beautiful memories
I
and
know.
conversations and experiences, right?
Mhm.
And yeah, and this is why I'm so thankful for people like you and others, that are doing this amazing, powerful work. And I wanted to ensure that I get you on my podcast so I can also assist, thinking about my daughter and even just to check myself. Like we talked about once in a while, I'm like, "Oh, maybe I should." I'm like, no, I do
No,
not have to. I do
don't
not
do
have
it.
to check myself because the influence is so powerful,
I
Megan.
know.
It's
I
so
know.
out there. You're being bombarded every day. Like I literally have to check myself. And
Yeah,
I'm, in my 40s, right?
right.
Imagine these young kids,
I know.
that like my daughter is 15, her friends are 15, 16. The 20-year-olds, like, what are they relying on to check them, right? They're so young. That's all
Yeah.
they know. We know better, right? We grew up differently. That's the part that really scares me.
It's really scary because the virtual and the AI filters have really taken over. So I have a daughter too. She's 5. She's not
Yeah.
quite there yet, but I do wonder what it's going to be like for her and what her expectation of beauty is going to be when, she looks a certain way, but maybe on her screen she sees all these images. I mean,
Yes.
even like growing up, I was totally influenced by magazines, things
Yeah.
like that, and that wasn't nearly as crazy as the AI stuff is now in
Yeah.
terms of what it can augment and alter.
Yes. Yeah. Yeah.
So, stay
Megan,
away from that stuff, ladies.
wait, what parting advice do you have?
Yeah, well, I would just say, honestly, spend less time on social media. That alone
That's a
will
good one.
Yes, look
Step
at the
out and
people.
look at normal humans.
Exactly, exactly. That is really probably the best advice I could give everyone. Don't be tempted by the Botox lie. It is such a lie. It is poisoning you every single time. It's just that some people don't have symptoms right away. Eventually, most people are going to get poisoned by this drug because it's really hard on your liver and kidneys too to have
Yeah.
to like filter that stuff out. Um, so yeah, don't fall for the lie. Surround yourself by real people who have priorities like things like kindness, love, you
Yeah.
know, intelligence, things like this that are so much more important than the texture of our skin.
Yes.
That's
Thank you,
what I would
Megan,
say.
for all the powerful work that you're doing. You're making a difference.
Oh, thank you.
We're so lucky to have people like you advocating and sharing the message and getting it out there. So thank you.
Thank you so much for having me.
Okay.